It's hard to imagine in our information age that access to it might be hindered. That's the reality for many people living in our rural communities. And as we discover, they're often left behind when it comes to getting important information about health and safety issues. The pandemic has certainly heightened those problems. Tonight, ABC Action News reporter McKenna King is digging into this issue, telling the story of a family dealing with the challenges and talking to the experts about the hardships many in these communities are facing.
Let's start here. This is the CDC's Social Vulnerability Index. The darker the color, the more vulnerable the population in terms of health and income. Often those areas are in rural communities.
About 46 million Americans live in rural areas in the United States. That's about 1 in every 7 individuals.
A significant portion of the population often left to fend for themselves in a sense. And when it comes to a global health crisis, the situation is only amplified.
They're really in many ways at higher risk of adverse outcomes from COVID-19. And that's in part because in general, in rural areas, you have people who are older. They have higher rates of chronic disease, even after you adjust for the fact that they're older.
More vulnerable, yet less likely to have access to information needed to protect themselves.
What would you say are some of the biggest challenges a rural community faces in a situation like we're in a global health crisis?
Yeah, I think it's access to information.
So now let's bring things closer to home. I traveled to Highlands County, straight to the home of a family in a rural community that has tackled every curveball this pandemic has thrown.
COVID was not like the first thing on our mind. So when I dropped him off, I really was shocked to get the phone call to say that it was COVID and they were going to admit, having no idea it would be 125 days later until I would see him.
Hi, John. It's Christy.
125 days and 3 different hospitals.
They admitted me, and next thing I know, I woke up in a second hospital.
For a virus that hadn't really hit Highlands County.
It did come a little later, about 4 to 6 weeks later than Tampa and other bigger cities were hit.
Some places said, oh, it's just the flu. It's just like the flu, and it's not like the flu.
He had less than a 5% chance of survival at one point.
And the COVID diagnosis wasn't the only uphill battle the Scagliones would face.
A lot of times we had patients, unfortunately, all by themselves in the hospital. And so now not only are they sick, but they're having to advocate for themselves.
Communication was just really difficult. It's so important to have an advocate for your health. So I really had a lot of contacts, a lot of phone calls that I made to different people throughout the hospital staff to try and actually get them to establish doing video calls.
Advocacy is something people in rural communities are used to.
I actually put up a Facebook post and put a call out for the convalescent plasma to work as his advocate.
They tell me if you want the information, you put in a little extra effort to seek it out yourself.
If you need an advocate, you need to be your own advocate.
In the midst of a COVID battle and today working to seek out factual information about vaccines in a place where the internet isn't the first place you turn.
If you're not going on to social media or, things like Facebook, you're not seeing it. So, I'm not getting things in the mailbox. I'm not seeing posters around.
And getting that crucial information takes an ongoing effort. In Sebring, McKenna King, ABC Action News.